Good morning. I will call the order of the Washington County Board of Supervisors monthly meeting for the month of February 19, 2021 to order. Supervisor Claire, would you lead us in prayer, please?
Thank you, Chairman. Dear Father, please guide each of us through these crazy times. Help us to know what is important. Help us to be patient and be kind and act with care and know that tomorrow will come. Please be with the folks in Texas and the Southwest during their time of need. And always, we give thanks to all of our essential workers, our highway crews through this winter, and the many volunteers that hold us up every day. Amen.
Thank you, Sue. Dave, would you like to lead us in the pledge, please?
Please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In case of fire or other emergency, there's 3 exits to this room, there, and there. In case of such emergency, please proceed to the nearest exit. Find the nearest stairwell, go down the stairwell, and exit the building and clear the building so rescue squads, emergency squads can do their job. If you need assistance, please contact one of us and we will help you out of the building. For the purpose of this meeting, please silence your cell phones. Thank you.
Thank you, Supervisor O'Brien. Deb, would you do the roll call, please?
Mr. Hankey.
Here.
Mrs. Fedler.
She's here. She's waiting.
Mr. Ferguson.
Here.
She's here.
Mr. Shaw.
She's on the screen. Yeah, the picture's not, but it's...
Mr. Hall.
Here.
Mr. Losaw.
Here.
Mr. Hicks.
Here.
Mr. Ward.
Here.
Mr. O'Brien.
Here.
Mr. Half.
Here.
Mr. Campbell. Mr. Skelly.
Here.
Mr. Hogan. He's here, okay.
Here.
Mr. Wilson.
Here.
Mrs. Clary.
Here.
Mr. Griffith.
Here.
And Mr. Rozell.
Here.
And we have a quorum. Okay. Deb, if you'd like to
Okay.
read the notice.
Public hearing concerning introductory local law A of 2021. Notice is hereby given that the Washington County Board of Supervisors will hold a public hearing on February 19, 2021 at 10:05 a.m. via teleconference to consider the adoption of proposed introductory local law A of 2021, providing for the salary of the county administrator. Copies of said local law A of 2021 are available on the county website. Further notice is hereby given that comments for the public hearing will be through Zoom video conferencing of the meeting. Anyone wishing to comment, complete the registration form on the county website. Please take further notice that comments for the public comment portion of the public hearing can also be sent in advance of the meeting to the supervisor's email address, and to the extent one does not have access to the internet, send comments to the Washington County Board of Supervisors. By order of the Board of Supervisors dated January 25th, 2021.
Okay, we'll now open up the public hearing on February 19th, 2021 regarding local law A at 10:04 a.m.
10:05.
10:05, I apologize. Okay. Is there any comments from the supervisors? Any comments from anybody in the public? I don't believe we have anybody that signed in. No one has signed in. Going once on questions or comments? Going twice on questions and comments? And we'll do it a 4th time. And if not, I will entertain a motion to close the public hearing.
Motion.
Cassie Fedler, Supervisor Fedler. Is there a second? Supervisor Losaw, Supervisor Wilson, Supervisor Ward, Supervisor Clary, Supervisor Ferguson, Supervisor Griffith. Is there any discussion? All in favor, say aye.
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 Opposed? It's carried. The introductory local law is closed at 10:05. Okay, we will now move on to the presentation of the employee retirements. As you can see on your agenda, we've had 9 individuals that have retired here within the past year. And their combined services, and there's 226 years of service. Leslie Allen, who was the Board of Elections, had 11 years. Anthony White in probation had 32 years. Brian McWhorter with DPW had 30 years. Ricky Robertson, also with DPW, had 29 years. In public health, we had Patty Hunt, who had 34 years. Kathy Easton, who had 19 years. And in the sheriff jail combination, we had Stephen Dougherty with 17 years and Keith McMurray with 34 years. And down at DSS, we had Jean Marie Longdren, who had 20 years. And with that, we lost 226 years combined of knowledge and expertise and leadership. And we're certainly grateful for the service that they provided to the residents of our county. And each of these retirees shall receive a slate-framed retirement certificate, and we'll be making coordination with them to see that they have those. So, would any supervisors like to make comments on any of the retirees?
No, I'm gonna miss having Brian come into the restaurant for breakfast and berate me about, what truck we bought or things like that. I'm gonna miss that. Brian, when we lost Brian McWhorter, we lost a real work ethic. He was a real take charge sort of a guy.
Okay. All right. Any other comments? Then we will go on to the condensed minutes. The condensed minutes from the January 15th and 22nd, 2021 meetings are accepted as mailed unless there are any additions or corrections. Do we have any additions or corrections? Seeing none, those are accepted, and we move on to communications.
For communications from Senator Jordan, we've received information about an opportunity to be recognized as a Purple Heart community to further salute the selfless service and courageous sacrifice of America's armed forces. From Assemblyman Smullen regarding advancement of Assembly Bill A4074 from the Environmental Conservation Committee to the Assembly floor regarding conservation subdivisions in the Adirondack Park, and correspondence from a resident regarding COVID and to let the kids play sports. That's all I have for communications.
Thank you. Great. That brings us up to our COVID-19 update with Tim Hardy. Tim, you available?
Good morning, everybody. Let me just share my screen here with you. All right, hopefully everybody can see that. And we'll roll through this morning's update. Got a lot to talk about, so I'll keep it as brief as I possibly can. Just some updates. So the coronavirus information site is still our main landing page for all the information that we update every day. WashingtonCountyNY.gov/coronavirus. It's got all the updated statistics. We are still doing the active cases by town map, which is published every Friday. It includes the updates on vaccination efforts and events here in the county, as well as any updates on the operations or departments. Sign up for the daily e-newsletter and important links to information from the Department of Health. Public Health is continuing their 7-day-a-week operations due to the workload. Even though the cases are coming down, there still are still plenty of cases and a lot of work that they're doing every day. Additional staff is still working, and now we've added over the last month our vaccination pod events. Current active case data, this was as of close of business yesterday. We're back down in our persons under monitoring. We're down to 150. Active positive cases, 89, and 6 people in the hospital as of yesterday. This is our active COVID statistics by date since we started tracking them back in May. These are only your active cases by the day, and I did upload this to the chat for everybody so you have a copy of that. And this is our historical statistics that we've been marking since day one back in early March. And obviously the only one that's not going to go down on that is going to be the positives that you see and the deaths, unfortunately. So the pod events began for us on January 21st, and we've been operating regularly every week since. The vaccine supply arrives every week, usually at the beginning of the week, and it must be utilized as directed. Just some information for your constituents and anybody watching out there. The best things that you can do is don't settle on one source for vaccination. It's very difficult to get vaccine. We've seen that everywhere across the country, and certainly it's no stranger to us here in New York. Eligibility is huge, and then continuing to just check the different resources. So here locally, we have the information on our website, on our Facebook, the public health Facebook. It goes out in the daily e-newsletter. We have the vaccine helpline, which is active when registration is open. If registration on an event is not open, it's a recording of the county events, so people without internet can at least know when the events are going to be scheduled for or have any other updates. Same thing, access to the New York State vaccination sites, call-in number there for people who do not have internet access. Encouraging people to check with their healthcare provider, and then obviously the local pharmacies who have started to receive vaccine in much larger amounts than they were previously. So we made some quick hot links to all those: Walgreens, Rite Aid, CVS, and Hannaford, so people can easily get to those sites. Our public health team certainly remains committed to ensuring that everybody who wants to be vaccinated can be vaccinated. But obviously the distribution process is very slow. The supply is very limited, and certainly we're limited by eligibility factors in the state's process. So some changes that we made after the first initial few rounds: we initially opened up vaccination to the 1B essential personnel and focused on our first responders in our community, being those were the ones that were sending in to people's homes and that are in the most vulnerable state outside of our senior population. So new changes that we instituted is we're going to announce any open pod that's open to the public the day prior to registration being opening. So people know when registration is going to open. It gives them a little bit of time ahead of time to prepare to get to that link or to call into the helpline. And a great effort between public health, public safety, DSS, social services, and ADRC. We opened that helpline and we threw anywhere from 7 to 10 people at that. And it's busy every time that we open any kind of registration. It usually runs for about an hour if we're lucky enough to go that long. The online registrations run for about 1 or 2 minutes, depending on how many appointments are available. So they really do go that fast, but certainly we're making every effort we can to reach as many people as we possibly can. For anybody in your communities with internet access, the best method of staying informed is to sign up for the daily e-newsletter. It goes out every day. It will have any announcements regarding vaccine updates, anything like that, when registration is going to open, and then talk about events afterwards and such. Eligibility for vaccination. This has been one of the main problems that we've experienced. Public health, us at the pod sites, is the difference between being labeled an essential person by your employer, by the county, by anyone else, and being eligible for vaccination. So when you talk about the phase distribution plan that the state has rolled out, which is available at that link there, phase 1A included healthcare. So those are your doctor's offices, hospital folks, dentists, any of those kind of personnel, nursing home personnel. Phase 1B, which we're allowed to vaccinate in, and right now our focus is on essential personnel at the direction of the state, also includes 65 and older and the new comorbidities and medical conditions. All of those are separate categories though. So if we have a pod for essential personnel, we're only allowed to vaccinate those personnel that fall into that essential personnel category, not the 65 and older and not the comorbidities or medical conditions. Those are separate categories within that 1B. One of the other struggles that we're also experiencing here is that we're not allowed to vaccinate the people in the 1A category. So when we get the nursing home employees or a nurse who functions outside of any of the 1B categories, we're not allowed to vaccinate those by state direction. Those are supposed to be done at the hospital level. I can tell you public health, and certainly, ourselves and Mr. Hankey and the chairman are advocating to the Capital Region Control Room that we change that. We certainly struggle very much with why we can't vaccinate a nurse on top of any of the other categories. So that's something that we're working statewide to get changed as well. Essential versus eligible, again, the biggest struggle that we're experiencing with people is they sign up and they confirm that they are eligible. And in turn, when they arrive, they may not be eligible, and they struggle to understand that because their employer has deemed them essential. That is not a determination that we make. The eligible categories are set by the state currently. And those categories, while specific, there are some that are very generic. So we've experienced with some issues of people in different categories who say, I am a support member for this agency. You have to be, as of right now, with supply as low as it is, a direct support member. So just because you may be a third or fourth line support member to an agency doesn't make you eligible for vaccination as of yet. As soon as the vaccine supply increases, certainly that will open up. But these are things that the county, it's out of our control and public health's control. But we are certainly doing the best we can to navigate these processes. But just some information, who's vaccinating who, and this is in accordance with the state's plan. Hospitals are the ones that are continuing to prioritize the unvaccinated healthcare workers identified in phase 1A. Your pharmacies and physician networks practices, your Hudson Headwaters, the local practices are the ones that are going to start getting that vaccine regularly for the 65 and older. That's at direction of the state and the federal government now. So they're starting to receive that directly outside of the state's distribution plan. Your FQHCs like Hudson Headwaters are going to get that direct, and so are the pharmacies. And then down to your public health agencies have to continue to prioritize that essential worker population and residents of the OPWDD facilities, staff members there as well. They added in the comorbidities can be vaccinated by local departments of health. The problem is we're limited. So if we receive a supply, we'll just use a number of 300 for a week. 200 of that may be for 1B essential personnel. 100 may be for comorbidities. The difficulty with that is determining who is eligible in that comorbidity category. So we're still working with our local healthcare providers, the Hudson Headwaters, Glens Falls Hospital for their local facilities in the county, or any of the other doctor's offices to work to vaccinate their personnel. They know their patients better than we do, certainly, and who has those comorbidities. So moving forward, that's going to be a good partnership for public health as well. So just an update on our COVID-19 vaccination operations in an effort to be transparent and forthcoming to everybody. We posted this information on the website. It lists every vaccination event we've had, the type of eligible group that exists there, whether it was a first dose or second doses, and then the status of it. So if it's complete, it also has the number next to it of how many vaccines were delivered at that event. So as you can see to date, we're up to 1,872 first doses of vaccine. That breaks down to 919 1B essential personnel, which includes first responders in the first couple of groups, and then opened it to the other essential personnel, teachers, grocery store workers, anything else that falls into those categories. The 65 and older, 847. And just a note on that, as I said before, those are really being directed towards pharmacies and the healthcare providers. We were one of the few counties that received a few first doses of 65 and older in large shots. So you could see we did the 323 and 321 back in January. Most counties didn't receive that because their pharmacies had already started receiving vaccine. Ours had not. So that's why we got those 65 and older when we did, and we haven't seen any since. And the last one you see on there is the OPWDD. We had an event and vaccinated 106 residents and staff of OPWDD facilities in Warren and Washington County. So we do have some second dose events coming up. Obviously, we know the supply chain right now is at a halt due to some weather issues across the country. So we did have to postpone our second dose event for first responders on Thursday night. And we're waiting to make the determination shortly on whether or not we receive vaccine to postpone our upcoming second dose events for 65 and older. Public health is truly committed to making sure we can get those second doses out. So we're trying not to cancel that if we don't need to. Unfortunately, we're just really at the mercy of the supply for today and making a decision on tomorrow. The state came out with a new vaccine tracker, which tracks vaccination progress by county. So I threw the link to that at the top, and you can see as of this morning on the site, 6,031 people in Washington County have been vaccinated. And that breaks down to, you can see the numbers there. But when you look back at ours, so you remember we did 1,872, and then you have that total of 6,031 total vaccines have been delivered. So you can certainly see how much public health has made a dent in that. Obviously, there are a lot of employees that work outside the county that reside in the county, and they're being, they're tied back to their residents as far as being vaccinated. So whether they're healthcare workers and went elsewhere or traveled to one of the state sites. Just to talk a little bit about the pod, if you haven't been to the pod that's set up over at Burgoyne, this just gives you a quick little overview of what it looks like. So the Burgoyne campus, which has been very well laid out for this event, actually. You can see the entrance, we've marked it out very clearly. A lot of great work by our senior safety officer, who's coordinated all of the outside operations with the county attorney, and that's been a huge help to us, with some support from buildings and grounds, support from DPW outside, and some volunteers. Nice long hallway for registration. We can keep people nice and separated. Everything's marked out very well, thanks to some signs from DPW. And the vaccination room, we have a total of 5 vaccination stations that are up and running for these events. You can see our vaccination teams there, which are a partnership between public health and that county EMS vaccination team, which has worked extremely well for us. We've had a ton of support for them, and it's really worked out very well. That's a group shot of the EMS vaccination team and our public health personnel working at the pod. And just one highlight in there, you did see a very special moment where Patty, just prior to her retirement on our first vaccination event, was able to deliver the first dose of vaccine to her brother, Sergeant Tim Carroll, with the sheriff's office. So that was a nice event for Patty to be part of and for Tim to be part of as well, as we kicked off our first pod. So just a huge thank you of everybody who's really helped make these events go. Some of these events are longer than others. It takes a lot of work, but really it's a joint effort. Public health, the EMS vaccination team, buildings and grounds guys, boots on the ground have been absolutely excellent to work with. Public Works, Social Services, and ADRC, big help for us. Senior Safety Officer and the County Attorney coordinating the outside operations. The Sheriff's Office providing security for us, and our Serve New York volunteers. So it really takes a lot to make those events go, and we appreciate it. We've had a lot of positive comments back as far as the operation, the setup, and the ease of getting in and out. Everything's clearly marked and flows very well. So it takes a village to get that done. One other addition is Cambridge EMS took the initiative to start a testing program. They were able to work with us, and we were able to allocate some equipment to them to start doing some rapid testing down there. So that was a heavy lift on their part, developing policies and procedures, working to train their personnel and go through the process to get registered with the state as a certified laboratory to be able to do that. So just wanted to make sure that people know there is testing available in the county. Cambridge EMS outlines that whole process on their website. We have a link to it there. And again, the testing continues at the Warren County Test Site, which covers 5 northern counties. That does require either an MD or public health referral. The CVS pharmacies are still open for appointments, available online. You register, you go to the pharmacy, you pick up a packet, you test yourself, you put it in, it gets sent out, and you get your return within a few days. Your healthcare providers, Hudson Headwaters at Moreau, Broad Street, West Mountain, and Warrensburg are still testing, and the SUNY Albany Test Site, which is a drive-up, no referrals needed there. And I think this is the last thing, the higher risk sports, which we talked about previously. Originally, the IMT's determination was to hold on that after conferring with the school superintendents, our medical director, Dr. Guerra, and the public health team. Certainly, we continue to evaluate that as things moved. Obviously, you can see when we look back at our statistics, the numbers are definitely coming down and are certainly becoming more manageable for public health. Certainly, that doesn't mean there is no risk. I don't think we're ever to the point where there's no risk, at least not for a really long time. So we got our superintendents and medical directors of the school together with Dr. Guerra, the public health team and incident management team. And on February 11th, we released that guidance to participate in higher risk sports, recognizing the importance of sports and the positive impacts they play on our children, on our communities, those kind of things, and making sure that we can try and keep kids in school as much as we can. So in an effort working with the other counties, we developed that guidance that very closely mirrored what was happening in those counties around us, but provided that pathway for the schools and communities that wanted to move forward. So there's the information on that. And the last thing is just vaccination is only one step. We highly encourage everybody to please stay home if you're not feeling well. Be mindful of who you're visiting. Certainly contact tracing is still an issue. Honesty is a very important part of that process. Social distancing, avoid the gatherings, wash your hands, mask up, and if you're traveling, the travel advisories are still in effect. So if you have any questions.
I do. Sam, I have a question.
Yes, ma'am.
When they get the first dose, is the second dose automatically scheduled then, or do they have to go through a lottery process to schedule the second dose?
So no lottery process. The second dose, they're given the date at the time they get their first dose. With this first round, until public health could see how it played out, they weren't set for the time of their return appointment. They were set for the date. And obviously, this weekend's a perfect example of with no vaccine in hand, we are waiting to confirm the time of those appointments for anybody until we have the vaccine. Now, under normal circumstances, second doses are guaranteed to us. This obviously was an unforeseen thing nationwide that caused the issue with not receiving this. We are evaluating with public health moving forward on how to change that and be able to issue both a date and time on the return of that. That certainly has been one of the things that we're getting the most questions about right now.
Is that one of the things that is designed on how you set up the pods here in Washington County, or is that how the pods are supposed to be set up nationwide, that you're supposed to be issued your second date?
So you have to issue a second date with it. The time frame was something that public health wanted to wait on before we did it until we saw how the first batch came through. And obviously this weekend we're changing the times. Our first event really was a throughput test to see how many people we could vaccinate at what time interval. So we're actually changing the time interval. So our first, we'll use our 65 and older as good examples. We started out doing like 10 to 6 p.m. which we know there was way too much downtime in there. We could certainly increase the throughput and get a lot more people through like we did in the later events. So it ended up being beneficial to look at time changes. So when we do move forward with our 65 and older ones that we're doing, we're gonna move those to 10 to 4 because we can actually increase the throughput. But moving forward, yes, we have been meeting with public health on figuring out a way that we can set the date and the time when they issue those appointments. So when they get their card, they'll know exactly when to come back, date and time, instead of just a date and wait for the time.
I was curious if it was just specific that our county was that efficient, or if that's the way it was supposed to be, because I've heard of some 65 and older out of state that got their first shot, but weren't giving anything for directives on the second shot, and they're struggling to get appointments, and they aren't weather related. They just, you had to make your appointment. And I thought originally the way it was supposed to roll out nationwide, that you were always supposed to have like a date, not necessarily a time. I just wondered if we were more efficient or if a different state is having a challenge and not following up the way it was designed.
I'd love to claim that we're more efficient, but you're supposed to issue a date for the second dose when you receive.
That's what I thought. That's what I thought. Okay. Oh, one more question. Is there leeway on your behalf to think of who's essential? Because I saw a quick report on the news the other night where Steve McLaughlin was bragging about how they vaccinated a certain type of worker, but I didn't think they were on the essential workers yet. So I don't know how he did that, and then went on the news and was bragging about how they took care of vaccinating those people.
So public health makes the final determination based on the list that's there. There are some categories that aren't very clear, but there are a number of things that have been run up the state's flagpole, for lack of better terms, and been returned as no, they don't fit into the category. Certainly public health, their focus is on vaccinating the frontline personnel that fall into those categories. And it's a struggle because you could make the stretch of some of the other categories as a support member for one of the other ones listed. The problem is we could get tied up for days in that, is that everybody is some level of a support level for, we'll use a law enforcement agency or a fire service agency or anything like that. So they're trying to focus on getting the frontline people out of the way. As supply opens back up and things increase, certainly will get a lot easier, and the channel will get much larger for who can be vaccinated. But public health has the ultimate determination based on whether or not they fall in or don't fall in. They certainly refer to the state on anything questionable that they're not comfortable making a decision on.
Thank you.
Yep. Yes, sir.
Tim, do you know if any of the vaccines have gone unused in our pods, or have we been successful in using every bit?
Yeah, we have used every drop. So you saw with some of the numbers, like in the seniors ones, we actually received 600 doses, and we actually vaccinated somewhere over 640. So I'm sure you've probably seen some things in the news that some of those vials, everything that we've got has been the Moderna vaccine. It comes standard with 10 doses in the vial. Some have 11, some have 12, some only get 10. So we're using every drop of vaccine that we've gotten. That's why we're able to do the 320 one day or the 330 the second day. So yeah, nothing goes unused. For every one of these events, we have a standby list for emergency call-ins and cancellations. So we have not had a time where we have not been able to use every dose that we've had on hand. Yes, ma'am.
Tim, I want to thank you and your crew. I know the amount of phone calls that I get is probably just a very little bit compared to what public health and your department are getting every day. And I'm sure this week has been even more difficult because they're anxious about getting that second dose. When you get that phone call, what do you say to them? Do you say, we're working as hard as we can. It looks like it could, do we have any sense that we will get it? If we don't get it for this weekend, will we get it for Wednesday or Thursday, or how would that work? How do you answer them?
We don't have a confirmation yet. I mean, we're certainly going to be tentatively starting to plan events for next week, with the hopes that if we don't get our supply today and we have to postpone for this weekend, that we'll start making plans for next week, and we'll make sure that we stay in contact with those personnel. And obviously we have the list that everybody registered with, either email or phone number for those that didn't, that we're pushing out that information, but we're continuing to push it out publicly as well in the daily updates everywhere else. You know, our hope is that the supply, or at least we get what we're intended to get. And our focus really right now is on getting every one of those second doses where they need to be as soon as they're received. You know, that may take a little bit off of the first doses we're able to deliver for a little while, but we have to get caught up with those people we've already vaccinated. Public health is definitely committed to making sure that happens. So we don't want anybody who already got their first dose to have to worry of, are they going to get their second? You know, we're going to make that happen.
Thank you.
Yep. Yes, sir.
Tim, can I infer from your presentation that going forward, say post next week, you're probably from the Washington County pod going to be doing mostly essential personnel, 1Bs, et cetera, and that if anybody is over 65, their best bet is to try to register online through one of the pharmacies to get a vaccine. Is that a reasonable conclusion?
Yes, unless the eligibility factors change and the counties are allowed to vaccinate outside the categories they're currently being assigned. Yes, the state-run sites can vaccinate anybody. So if you see one of those state-run sites, they can vaccinate healthcare, 65 and older, comorbidities, or essential personnel. The counties are limited to whatever they're limited to. You know, we had those couple of shots of 65 and older, which were great for us to be able to do our seniors right here in our own backyard and not have them travel. We certainly have advocated and hope that comes back to us. But as of right now, that's what we're tied to. One other point to mention, I believe the governor announced the other day in one of his releases that he's encouraging the counties or open to counties working together with the state to open up sites. You saw some media coverage surrounding a site in Queensbury that Washington and Warren County were working on together. That certainly is something we are still continuing to focus on. Obviously, it's going to be a state-run site supported by both counties. So we're really limited to the supply being able to come in to have that go. That certainly will be a high volume site. So I don't know the exact number the state's going to push out of there, but it will be a considerable amount in a daily, a daily throughput. So that's something to also keep out there. I mean, those appointments, obviously everybody knows those appointments go fast, but if we can get something much closer, the chairman and Mr. Hankey certainly have been advocating on the control room that we get that site operational as soon as possible. It'll at least give a lot closer access for our communities here. You know, you can see our vaccination numbers, you know, relative to our population are still low. We would love to be vaccinating a lot more than that, but we can only vaccinate what we get vaccine for.
Right, so we should advise our 65 and older that they should probably be looking at state sites and pharmacies rather than anticipating at some point there will be 65 vaccines at our pod, correct?
Absolutely. Yep, state-run sites and pharmacies should be the primary point unless something changes for us.
Thank you.
Any other questions of Tim? Tim, any further comments?
No, just want to give a big shout out to public health. I mean, they're doing vaccine on top of all of their daily stuff. Certainly that is something that every public health professional aspires to do in their career, is vaccinate the public on something like this. None of us want to be in the situation we're in, but I honestly appreciate all the work they're doing, and they're absolutely amazing over there. So that's it.
Thank you, Tim. I want to thank you for all the effort and time that you put into this, and the way you're able to juggle all the different balls at different times to make the pieces fit in the puzzle. And we're much better off as a county because of the effort. So thank you very much in heading up that team.
Team appreciate.
At this point in time, no, go ahead, Tim, sorry.
I just said on behalf of the team, we appreciate that very much. And all the support that we've heard so much positive feedback regarding the pods. I know public health wishes they could do more because it really has been a rewarding experience for those we've been able to get in. And we understand the frustration of everybody who can't. It is a process that we really wish we could do more with and change. But we're continuing to evolve in our own process and change things that we can. Just unfortunately, there are some things that are really out of our control. But thank you.
Thank you. All right, then we will move on to the committee reports, audit report.
Mr. Chairman, I'd like to move the audit committee report.
We have a motion to move the audit committee report. Do we have a second? Supervisor Clary, Supervisor Hogan, Supervisor Ferguson. Okay. Is there any discussion? All in favor, signify by saying aye.
Aye.
Opposed? Carried. Supervisors privilege of the floor. Would any of the supervisors like to comment, or do we have anyone that we know that's out there waiting for supervisors privilege of the floor? No. Sandy tells us no, we have no one. And if there's nothing from the supervisors, at this point in time, we will move on to introduction of resolutions. And I'd like to request a motion to waive the reading of the resolutions. Everybody should have received about the last, except maybe the last one or two of them. Supervisor O'Brien moves it. Do we have any seconds?
Second.
Supervisor Wilden, Supervisor Ward, Supervisor Henke. Okay, is there any discussion? All in favor say aye or raise a hand.
Aye.
Opposed? Carried. And we now move to consideration of the resolutions. Deb, if you would start, please.
Resolution number 26 by Supervisor Skelly, Rozell, Campbell, Haff, Hicks, Fedler, Shaw, Ferguson, Wilson, title, a resolution authorizing the implementation and funding in the first instance 100% of the federal aid and state Marshall-Selley program aid eligible costs of a transportation federal aid project and appropriating funds therefore Church Street Bridge over the Meadowee.
Mr. Chairman, I would move resolution 26.
Second.
Moved by Supervisor Skelly. Do we have seconds? Supervisor Fedler, Supervisor Rozell, Supervisor Shaw, Supervisor Wilson, Supervisor Campbell, Supervisor Losaw, Supervisor Henke. And I don't believe I missed anyone. Is there any, Supervisor Ferguson? Is there any discussion? All in favor, signify by saying aye or raise a hand.
Aye.
Opposed? Carried.
Resolution number 27 by Supervisor Hall, title, appoint members to the counties of Warren and Washington Industrial Development Agency and Civic Development Corporation.
I will move that resolution. Do we have any seconds? Supervisor Henke, Supervisor Fedler, Supervisor Wilson, Supervisor Ward, Supervisor Ferguson, Supervisor Griffith, Supervisor Losaw, Supervisor Rozell. Is there any discussion? All in favor? Aye or raise a hand. Oh, got a question. Oh, I think we got a question from Dana. Yes, Supervisor Haff.
Thank you. During the past year, we've seen things where the IDA attempted to venture into solar, despite many towns opting out of 47. They continued on with presentation after presentation after presentation where they should have nipped it in the bud. Also, the dewatering facility, they ventured into a risky acquisition of that when there's a plethora of industrial sites available. Warren, Washington, Saratoga County is kind of a buyer's market. So why would you try to market something that there's many, many sites around? So I'm a little bit upset with the membership. I think they've lost sight of their mission, more interested in gathering fees. So I'm voting no on the entire slate of membership.
Okay, thank you. Is there any further discussion? If not, we'll call for the vote. All in favor, signify by saying aye. Raise a hand, please.
Aye.
Aye.
Aye. Opposed?
Nay.
Nay. Supervisor Haff opposed. Carried.
Resolution number 28 by Supervisors Campbell, Hicks, Shaw, Skelly, Griffiths, title amend resolution number 98 of 2017, Washington County Planning Agency membership and appoint at-large member.
Moving resolution 28.
Moved by Supervisor Campbell. Do we have a second? Supervisor Hanky, Supervisor Fedler, Supervisor Griffith, Supervisor Ward, Supervisor Ferguson. Is there any discussion? Supervisor Hicks.
I just wanted to clarify, we're going to appoint Allison Gaddy, which I think is a great idea. She'd be tremendous to be on this committee. But are we appointing Allison to take the spot, or are we appointing the planning board, the Champlain Lake George Regional Planning Board person, so that if, say, if Allison took another job, would the next person be the person holding that title, or is it are we appointing the position or the person in that position? I just want to clarify. I'm good either way. I just wanted to make sure we understood what it was.
The person, yes, the individual.
Just the person.
The individual, yes, sir.
Gotcha. Thank you.
You're welcome. Any further discussion? All in favor, signal by saying aye.
Aye.
Or raise your hand. Anyone opposed? Carried.
Resolution number 29 by Supervisors Hicks, Ward, Campbell, O'Brien, Skelly, Clary, Griffith, title to adopt introductory local law A of 2021.
Mr. Chairman, moving resolution 29.
Moved by Supervisor Hicks. Do we have a second? Supervisor Hanky, Supervisor Losaw, Supervisor Ward, Supervisor Campbell, Supervisor Ferguson, Supervisor Griffith, Supervisor Clary, Supervisor Fedler, Supervisor O'Brien. Is there any discussion? Then we'll have a roll call, please.
Mr. Hanky?
Yes.
Mrs. Fedler?
Yes.
Mr.
Yes.
Ferguson?
Yes.
Mr. Shaw?
Yes.
Mr. Hall?
Yes.
Mr. Losaw?
Yes.
Mr. Hicks?
Yes.
Mr. Ward?
Yes.
Mr. O'Brien?
Yes.
Mr. Happ?
Yes.
Mr. Campbell?
Yes.
Mr. Skelly?
Yes.
Mr. Hogan?
He dropped off. I don't see. I see his name. I don't
He's
see.
there.
There he is. He's
Yes,
back.
Steve.
Yep. Yes, he's got a yes. Come up.
Mr. Wilson?
Yes.
Mrs. Clary?
Yes.
Mr. Griffith?
Yes.
Mr. Rosell?
Yes.
The resolution is adopted, 4,260 yes. Resolution number 30 by Supervisors Ward, Hogan, Happ, Hicks, O'Brien, Clary, titled to approve Washington County Policing Reform and Reinvention Plan pursuant to Executive Order 203.
Do we have a motion?
Yes, Mr. Chairman, moving resolution number 30 forward.
Moved by Supervisor Ward. Do we have seconds? Supervisor Hanky, Supervisor Clary, Supervisor Fedler, Supervisor Campbell, Supervisor Ferguson. No further seconds. Is there any discussion? All in favor, aye, or raise a hand, please.
Aye.
Aye. Opposed? Carried.
Resolution number 31 by Supervisors Clary, Campbell, Skelly, Ferguson, Losaw, Ward, Wilson, titled approve COVID-19 surcharge amendment to Washington County preschool transportation contract.
Do we have a motion? Supervisor Clary? She's got her hand up. She made the motion. Seconds.
Second.
Second. Supervisor Campbell, Supervisor Ward, Supervisor Losaw, Supervisor Wilson, Supervisor Hanky, Supervisor Ferguson, Supervisor Fedler. Is there any discussion? All in favor, aye.
Aye.
Opposed? Carried.
Resolution number 32 by Supervisors Hicks, Ward, Campbell, O'Brien, Skelly, Clary, Griffith, titled to set end date for resolution number 157 of 2020, addressing unused vacation and/or personal time due to the COVID-19 pandemic.
Mr. Chairman, resolution 32.
Moved by Supervisor Hicks. Second, please. Supervisor Henke, Supervisor Fedler, Supervisor Clary, Supervisor Skelly, Supervisor Griffith, Supervisor Ward, Supervisor Campbell, Supervisor Wilson. Is there any discussion? All in favor, say by saying aye, or raise a hand.
Aye.
Anyone opposed? Carried.
Resolution number 33 by Supervisors Hicks, Ward, Campbell, O'Brien, Skelly, Clary, Griffith, title amend staffing patterns, Sheriff.
Mr. Chairman, moving 33.
Moved by Supervisor Hicks. We have a second. Supervisor Henke, Supervisor Fedler, Supervisor Griffith, Supervisor Ward, Supervisor Campbell, Supervisor Ferguson. I don't think I missed anyone. Is there a discussion? All in favor, signify by saying aye. Raise a hand. Opposed? Carried.
Resolution number 34 by Supervisors Hicks, Ward, Campbell, O'Brien, Skelly, Clary, Griffith, title amend staffing pattern, Department of Social Services.
Mr. Chairman, moving 34.
We have a motion by Supervisor Hicks. Do we have seconds? Supervisor Henke, Supervisor Clary, Supervisor Campbell, Supervisor Ward, Supervisor O'Brien, Supervisor Losaw, Supervisor Fedler, Supervisor Griffith, Supervisor Ferguson. Is there any discussion? All in favor, signify aye.
Aye.
Opposed? Carried.
Resolution number 35 by Supervisors Campbell, O'Brien, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losaw, Ward, Griffith, title to correct tax roll.
Moving resolution 35.
Moved by Supervisor Campbell. Do we have seconds, please? Supervisor Henke, Supervisor Ward, Supervisor O'Brien, Supervisor Fedler, Supervisor Clary, Supervisor Shaw, Supervisor Griffith, Supervisor Roselle. Did I miss anyone? Is there discussion? Supervisor Ferguson. Was that discussion or did I miss your second, Paul?
My second.
Okay, I apologize. And Mr. Ferguson was a second also. Is there any discussion? If not, we'll take a vote. All in favor, say aye or raise your hands, please.
Aye.
Opposed? Carried.
Resolution number 36 by Supervisors Campbell, O'Brien, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losaw, Ward, Griffith, title amend 2021 OFA budget to carry unspent COVID-19 ADRC stimulus funds.
Moving resolution number 36.
Moved by Supervisor Campbell. Do we have a second? Supervisor Henke, Supervisor Losaw, Supervisor Ward, Supervisor Fedler, Supervisor Clary, Supervisor Griffith, Supervisor Ferguson, Supervisor Roselle, and I believe that's it. Is there any discussion? All in favor, signify by saying aye. Raise your hand. Opposed? Supervisor Haft.
Discussion, please. I'm just asking a question about the optics of it and how this actually works. If we're going full speed ahead on COVID, how do we have leftover money? Shouldn't we be in a position where we say we don't have enough money?
It's just because it crosses years, Dana. They just have to have it still available to do the work they do.
But the money that's left over was 2020 money, right?
Yeah, but it's different fiscal years is all. It's still in the 21 year for the state, or that ends in 21.
So it's just
this is federal money. So this is even a worse deal.
All right, so it's just a calendar. It's just a fiscal year calendar.
Yeah, so it's October. So it came later, so it goes longer. So in other words, you don't get a chance to spend it by the time it comes. So you have to move it into the following year.
Okay, thank you.
Any further discussion? All in favor, say aye or raise your hand, please.
Aye.
Anyone opposed? Carried.
Resolution number 37 by Supervisors Campbell, O'Brien, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losaw, Ward, Griffith, title amend 2021 DSS OFA budget to carry over unspent COVID-19 stimulus funds for home delivered meals program.
Moving resolution 37.
Moved by Supervisor Campbell. Second, we have Supervisor Henke, Supervisor Clary, Supervisor Griffith, Supervisor Fedler, Supervisor Roselle, Supervisor O'Brien, Supervisor Losaw, Supervisor Ward. Is there any discussion? Seeing or hearing none, all in favor say aye or raise a hand, please.
Aye.
Opposed? Carried.
Resolution number 38 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title amend 2021 DSS budget to carry over unspent CARES Emergency Solutions Grant funds.
Moving 38.
Supervisor Campbell has moved it. Supervisor Henke is a second. Any other seconds? Supervisor Losaw, Supervisor Ward, Supervisor O'Brien, Supervisor Roselle, Supervisor Clary, Supervisor Griffith, Supervisor Ferguson. Is there any discussion? All in favor, signify by saying aye. Raise a hand, please.
Aye.
Opposed? Carried.
Resolution number 39 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title amend 2021 DSS budget to carry over unspent Family First Transition funds.
Moving 39.
Moved by Supervisor Campbell, seconded by Supervisor Fedler, Supervisor O'Brien, Supervisor Losaw, Supervisor Ward, Supervisor Griffith, Supervisor Ferguson, Supervisor Clary, Supervisor Henke, and Supervisor O'Brien. Supervisor Roselle as well. Is there any discussion? Hearing none or seeing none, please either raise your hand or say aye.
Aye.
Those opposed? Carried.
Resolution number 40 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title amend budget capital project number 127, Church Street Bridge number 2 for Marchicelli supplemental aid number 2.
Moving resolution number 40.
Moved by Supervisor Campbell, seconds please. Supervisor Henke, Supervisor Clary, Supervisor Fedler, Supervisor Griffith, Supervisor Ferguson, Supervisor O'Brien, Supervisor Losaw, Supervisor Ward. Is there any, Supervisor Skelly, I'm sorry, Supervisor Roselle I believe. Are there any questions? Okay, then we'll go to vote. All in favor, signify by saying aye.
Aye.
Opposed? Carried.
Resolution number 41 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, Title II, authorize acceptance of grant from the Lake Champlain Basin Program for work in the towns of Whitehall and Fort Anne.
Moving resolution 41.
Moved by Supervisor Campbell, seconds by Supervisor Henke, Supervisor Clary, Supervisor Griffith, Supervisor Ferguson, Supervisor Roselle, Supervisor Fedler, Supervisor O'Brien, Supervisor Ward. Is there any discussion? All in favor, signify by saying aye or raise a hand.
Aye.
Opposed? Carried.
Resolution number 42 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title amend 2021 budget unallocable insurance.
Moving resolution 42.
Do we have a second? Supervisor Henke, Supervisor Fedler, Supervisor Griffith, Supervisor Ferguson, Supervisor Clary, Supervisor Roselle, Supervisor Ward. Is there any discussion? All in favor, signify by saying aye or raise your hand, please.
Aye.
Opposed? Carried.
Resolution number 43 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title to amend information technology 2021 budget and appropriate reserve funds.
Moving resolution 43.
Moved by Supervisor Campbell. Do we have a second? Supervisor Henke, Supervisor Fedler, Supervisor Losaw, Supervisor Ward, Supervisor Ferguson, Supervisor Clary. Is there any discussion? All in favor, signify by saying aye. Raise your hand. Anyone opposed? Carried.
Resolution number 44 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, Griffith, title to approve intermunicipal agreement between the Town of Kingsbury and Washington County Sewer District number 2.
Moving resolution number 44.
Moved by Supervisor Campbell. Seconds, please. Supervisor Losaw, Supervisor Henke, Supervisor O'Brien, Supervisor Clary, Supervisor Fedler, Supervisor Ward, Supervisor Roselle, Supervisor Griffith. Is there any discussion? Supervisor Hogan.
Stan, I'd like to ask Roger if I should abstain from this resolution.
I guess, as we've talked about previously, abstention would be up to you in this point. There's no direct benefit to yourself, and I would expect you to vote in favor of things that benefited the town of Kingsbury. So I would leave that
Okay,
to your
thanks.
personal discretion.
Thank you.
So then, Supervisor Holden, did you want to abstain or do you want to vote?
No, I'll vote yes.
Okay, very good.
Thank you.
So all in favor, signify by saying aye.
Aye.
Opposed? Carried.
Resolution number 45 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Rozell, Losaw, Ward, Griffith, title amend budget, capital project number 125, capital improvement plan for Burgoyne Avenue architectural survey.
Moving resolution 45.
Moved by Supervisor Kimball, we have seconds. Supervisor Henke, Supervisor Losaw, Supervisor Fedler, Supervisor Clary, Supervisor Griffith, Supervisor Rozell. Did I miss anyone? Supervisor Ward? Supervisor Ferguson? Is there any discussion? All in favor, signify by saying aye or raise a hand, please.
Aye.
Opposed? Carried.
Resolution number 46 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Rozell, Losaw, Ward, Griffith, titled authorized agreement with Lake Champlain, Lake George Regional Planning Board for conduct of Washington County broadband inventory analysis.
Moving resolution 46.
Moved by Supervisor Campbell. Do we have a second? Supervisor Fedler, Supervisor Henke, Supervisor Skelly, Supervisor Griffith, Supervisor Wilson, Supervisor Fedler, Supervisor O'Brien, Supervisor Losaw, Supervisor Ward, Supervisor Ferguson. Is there any discussion? All in favor, say aye or raise a hand. Aye.
Aye.
Opposed? Carried.
Resolution number 47 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Rozell, Losaw, Ward, Griffith, title to award bid for project 2021-1 Burgoyne Avenue roof replacement.
Moving resolution 47.
Moved by Supervisor Campbell. Do we have seconds? Supervisor Rozell, Supervisor Griffith, Supervisor Ferguson, Supervisor Clary, Supervisor Henke, Supervisor O'Brien, Supervisor Losaw, Supervisor Ward, Supervisor Fedler. Is there any discussion? All in favor, signify by saying aye or raise your hand, please.
Aye.
Those opposed? Carried.
Resolution number 48 by Supervisors Hicks, Ward, O'Brien, Skelly, Clary, Griffith, title to appoint Danielle Lupan, Washington County Personnel Officer.
Mr. Chairman, moving resolution 48.
Moved by Supervisor Hicks. Do we have a second? Supervisor Henke, Supervisor O'Brien, Supervisor Fedler, Supervisor Clary, Supervisor Skelly, Supervisor Griffith, Supervisor Ferguson, Supervisor Ward, Supervisor Campbell, Supervisor O'Brien. Is there any discussion? Seeing none, all in favor, signify by saying aye. Raise your hand, please.
Aye.
Opposed? Carried.
Resolution number 49 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Rozell, Losaw, Ward, Griffith. Title, Washington County Board of Supervisors secret resolution regarding issuance not to exceed $900,000 of serial bonds by the County of Washington, New York for the reconstruction and installation of improvements at the county's building and site located at 1153 Burgoyne Avenue and the acquisition of original furnishings, equipment, appurtenances required for the purposes of which such building is to be used in the County of Washington.
Moving resolution 49.
Moved by Supervisor Campbell. Second, please. Supervisor Henke, Supervisor Clary, Supervisor Ferguson, Supervisor Rozell, Supervisor Fedler, Supervisor Losaw, Supervisor Ward. Is there any discussion? All in favor, signify by saying aye or raise your hand, please.
Aye.
Opposed? Carried.
Resolution number 50 by Supervisors Campbell, O'Brien, Hicks, Feather, Skelly, Hogan, Clary, Rozell, Losaw, Ward, Griffith. Title, a resolution authorizing the issuance not to exceed $900,000 serial bonds of the County of Washington, New York for the reconstruction and installation of improvements at the county's building and site located at 1153 Burgoyne Avenue and the acquisition of original furnishings, equipment, appurtenances required for the purposes for which such building is to be used in the County of Washington.
Moving resolution number 50.
Moved by Supervisor Campbell. And we have seconds by Supervisor Henke, Supervisor Clary, Supervisor Ward, Supervisor O'Brien, Supervisor Ferguson. Okay, we will do a roll call on this, please.
Mr. Henke.
Yes.
Mrs. Sedler.
Yes.
Saying yes.
She said yes.
Mr. Ferguson.
Yes.
Mr. Shaw.
Yes.
Mr. Hall.
Yes.
Mr. Losaw.
Yes.
Mr. Hicks.
Yes.
Mr. Ward.
Yes.
Yes.
Mr. O'Brien.
Yes.
Mr. Half.
Yes.
Mr. Campbell.
Yes.
Mr. Skelly.
Yes.
Mr. Hogan.
Yes.
Mr. Wilson.
Yes.
Mrs. Clary.
Yes.
Mr. Griffith. Yeah.
I
Yes.
think so. Yes.
Mr. Rozell.
Yes. Yes.
The resolution is adopted, 2/3 vote, 4,024 yes.
Good, thank you. That concludes our resolutions, and we move on to supervisor comments. Do any of our supervisors have any comments? Supervisor Henke.
Yeah, I've got to, once again, start out with a couple of deaths, but before we do that, I wonder if we could have a moment of silence for Carol Campbell, Brian's mother, who passed away recently.
Absolutely. Thanks, Bob.
Thank you. I got a couple of rather prominent Argyle people that we lost in this past month. One was Pat Bonholt. That was active in all kinds of community stuff. I couldn't list through them all, but some that may be pertinent to or some things that may be pertinent to the county board here. Her husband Joel was a Argyle town supervisor and on this board for a long time, and her son Steve. They imparted the same thing to Steve. Steve's a member of my town council. So Pat's going to be missed. And another one we're going to miss is Bill Stevens. Bill was 93. You may know him as the fellow who started Butternut Ridge Farms, the produce place down on Route 40. He was also a prime mover in getting some of our local farmers markets in Glens Falls and Saratoga started. That was kind of his brainchild, and people are using them, dramatically to this day. They've been, especially the Saratoga and Glens Falls, and they've been really good deals, and Bill's going to be missed. Butternut Ridge is still going on. The family is still running it. I was very pleased to pass Resolution 46 today. In spite of the fact the governor says Washington County is 100% served with high-speed internet, those of us who have had to deal with the 65 and older people getting their shots realize just how poorly served we really are. It is terrible to hear the desperation in people's voices. They can't get on, the internet. They have no way of, getting emails back. It's just, I personally did 19 myself, sign up for our last thing. Our town clerk did as many, and I know that the rest of you have also done yeoman service getting our people signed up, but we've got some huge gaps in internet service throughout the county, and I think this sort of thing just really pops it in the mind. And I was kind of interested to note the number of people that retiring that have had 30 years of service with the county. That's really quite a great accomplishment. It's also kind of scary to think about the amount of institutional knowledge that we're losing with some of those people, I talked about Brian McWhorter because he's Argyle. Patty Hunt is a great example of the institutional knowledge that we're losing. It's I guess, good to think that we're the kind of employer that would, keep people here for 30 years, that they feel comfortable working here and happy and productive. So maybe a little bit of a pat on the back here. No, thanks, Sam. I'll have a motion to make after you're finished with Supervisor.
Okay, thank you. Are there any other supervisor comments? Supervisor O'Brien.
I was on a call yesterday with a number of actually Warren County Task Force. There was something that came up was the impact and distribution of stimulus funds to local municipalities. They listed out the amounts for the Warren County towns. I have asked this individual to provide us the information for Washington County, so we have some idea what potentially might be involved in stimulus funds. I will share that information as soon as I get it. I was also curious to ask, because he didn't know yesterday how this was being determined, was population based or what it was, but as I get that information, I'll share it with everyone.
Thank you, Dave. Supervisor Campbell.
Yeah, I want to, thank everyone that's condolences, supervisors, department heads, employees. It's been, kind of humbling and very appreciative. Thank Bob for a moment of silence beginning today. It was kind of nice, but in retrospect, none of us thought COVID was really affecting our area, but in my case, it's literally at home. And I guess that's the case with other people, but when it's out of sight, out of mind, you have a different perspective than when it actually hits home. I just want to share that with everyone.
Thank you, Brad. Are there any other supervisor comments? Supervisor Ward.
Yes, I'd like to thank Sheriff Murphy and his staff. That was a big effort to put the reinvention plan together. It was almost seamless. He met with the public several times, and through his leadership, I'm sure the plan will move along. And also to the board for approving the position for the Office of Professional Responsibility, because that's an integral part of the plan to make sure it's carried out, and the training meets the requirements of the plan drawn up by Sheriff Murphy. So I see other areas are struggling a little bit with accomplishing the mission, and Sheriff Murphy did it in record time, and it's a great plan. And I'd just like to thank Sheriff Murphy and his staff and the Board of Supervisors for supporting the 203 plan. Thank you.
Thank you, Supervisor Ward. Well said. Any other comments from any other supervisors? Okay.
Mr. Chairman, if we have no more comments, I'd like to make a motion to go into executive session for the purpose of discussing ongoing litigation.
Okay, we have a motion to go into executive session. Do we have a second?
Second.
Second by Supervisor Bryan, seconded by Supervisor Haas. Him. Is a question, Dana?
Yes, I think we should. Yes, I think we also have another reason, which I think is for possible purchasing or acquiring real property. Roger might be able to say the correct language.
No, you were right, for acquisition of real property.
Okay.
Mr. Half, I believe, has a report on the situation in Shushan.
Yes.
Okay. Very good. And do we have a second? Second by Matt Hicks.
You want to clarify who you're going to invite into the executive session?
Yes.
Supervisor?
I'm going to invite in the county treasurer, the county administrator, and the county attorney, as well as all of our supervisors, obviously. So if they could stay and join us. And the intent, unless someone anticipates we're going to have something to vote on, there would be to adjourn right out of executive session. That works for everybody.
Yeah, on my original motion, there'll be no action taken.
Okay. And I don't think, Supervisor Haft, do you anticipate any action taken on yours?
No, I'm just giving information.
Okay, thank you. So then the plan will be that we will adjourn right out of executive session. So we have a second, and favor moving to executive session? Aye.
Aye.
Opposed?